On behalf of
now it's time for our English session. Thank you, Dr. Sahan, for a wonderful English session. Thank you, Dr. Sridhara Kurup. Now let's begin our English session. Good afternoon, good evening, and good morning to one and all. Let's begin today's session with a silent prayer. I welcome all respected doctors and dear well-wishers to the 953rd day of Zoom meeting on International Session of IFPH. Today, the guest with us is the most familiar face of IFPH, is Dr. Hubert de Silva. He has 36 years of experience. He is also Chief Editor of IFPH Online Magazine and Moderator of IFPH webinar sessions. He is here to present on the subject Management of Cardiac Problems with Homeopathy. With all due respect, I welcome you, sir. Welcome, Doctor.
Thank you, Dr. Elizabeth. Can you hear me?
Yes, yes,
Okay.
It's audible, sir.
I want to share my screen. Before that, I want to say thank you all for we are hearing your voice of Hindi, our national language. We are not much familiar. We cannot make it fluently. We cannot speak. So we will try to study it day by day. We can also, within sometimes we will also perform like you. Thank you all for coming this session. And now I want to, eminent doctors are here, and we are very happy to engage everybody in our session. So today I have taken the topic of cardiology, heart diseases, how we can make and manage heart diseases. So let me share my screen. Is it visible?
Yes, sir.
There is a scripture says that blessed are the pure in heart, for they will see God. Blessed are the pure in heart, for they will see God. What to do? There are so many hearts are there in this world. We can see so many hearts. Sacred heart, immaculate heart, loving hearts, and these are different types of hearts. We have everybody having his own heart. We have one or two hearts. Some of our heart should be normal in size. Another heart, that is a spiritual heart, that should be bigger. It is better to make it big as the universe. The normal heart and the normal heart is our heart, always beating in our chest. But whenever say anything about something about anything, that time our internal heart will talk. So we have to make both hearts should be healthy, strong, beautiful, and fine. Then we can see the universe with its normal vision. We may have normal vision to see human being and God. This is our heart. I am coming to the topic of the physical heart we have. How beautiful the heart is. Can you say, can you see anything that is uniform in the heart? In our human body, can you see anything in a uniform like a square or like a circle or like a cube? There is no such anything in our body. Everything in a different way and different shape. Each and everything. Let us see this heart. Somewhere smooth and spherical, somewhere straight, somewhere curved, somewhere everything in our body. Always we can see that there is no uniformity. That is uniform in unit, a single unit. But it is varied, it is various in different body. No one is like another person. That is our individuality. Dr. Samuel Hahnemann, he did his wonderful work that saying he given much importance what we should treat the patient. Each and every individual is different. So how can make it? In some way, sometime we may use this medicine for a single medicine for to give us a genus epidemicus. A single medicine for a group of people or for the whole people. But we know that why our heart? This is the first bodily part generated in our human body. Development of the heart. It is, we all like this. Our all passed this condition in our, before our birth. The primitive blood vessels only single from the single body. The development of the heart. Let us see. Yeah. It is the formation of 18 days. After 18 days, like a tail. Cardiogenic area. Then it is developed blood flow. Endocardial tubes are forming. And each and every time fusion into primitive heart tube, it is getting shape. We all passed this stage. Our heart, all our hearts formed like this. From this part to making day by day, it is developing. After that, it will reach in a position to like this. So without, how Hahnemann came to this vital force theory? Without a supreme power or a knowledge, it cannot be created. Still now, the doctors, if there is any blockage in the blood vessels, they have to open it, they have to adjust it with some tubes, and operations should be done. And then only for all time. Yesterday, we might have heard that one of our eminent personality came to our platform, said that her father was 80 years old. He had a heart block. That time, doctors, you know that, the doctor said that you had to go for an operation. So it is, we know that such an operation having 3 lakhs rupees and sufferings, and he has to lay for a 2-3 months in the hospital, take rest. These are the things, the normal procedure of our heart operation. After he has to go, such things. That time, her father told her, he is a homeopathic doctor, told her, you buy Crataker's mother tincture. She bought it 76 rupees. He had taken it, and after 2 months, he again checked, his complaints all gone. Only 76 rupees is enough for to remove his heart block. Yesterday we heard it from his daughter told us, she was a dean. She's a dean of a university. And that time, 76 rupees is enough for, in homeopathic treatment, is enough for to remove a heart block. That is what the greatness of homeopathy. We can see that this heart, there are so many chambers. There are blood vessels coming in, blood vessels, blood going out from different parts of the body. It's reached in the chambers of the heart, and it may go from different parts of the body. Without a supreme power and without a supreme management, it will not happen. Even if a great, if it is Bill Gates or a man laying in the street, both have hearts. One heart may be that poor man have a good heart, but the richest person will not have a good heart. Maybe. So everybody having a heart. It is controlled, it is beat from our first day of our conception to till our end. So we must believe in God, that He is the one person who is creating all these things and controlling this and controlling and giving medicines to us and knowledge to us. So the knowledge must be pure. Otherwise, we cannot manage it. From the God itself, how Hahnemann developed such a theory of vital force theory? Without the vital force, the heart will not work. Whenever the God says that stop it, that time it will stop. Till then, it will beat. That is each and every person having a heart. So let us think about how it is functioning. The vital force theory. We know that heart is functioning. It is always, there is a, can you see it? Heart having two areas, main functioning. One is contracting and relaxing. During contraction of the ventricles, the blood will go out to the different parts of the body. And when it is relaxed, that time blood comes to our heart. What is happening in homeopathic medicines? We have so many medicines are there. We have several medicines are there, like digitalis, spigelia, aconite, arsenic alb, cactus, carbobage, China, amyl nitrosum, Crataegus. These are some of the medicine I told. Viscamalgum alba. These are normally we are using ivories. There are the medicines are using in homeopathy. What is happening in homeopathy? If one person is taking a medicine, anything, if it is acting on the heart, that time the heart muscles and its function may vary. It may vary. All the time, we can see that if some medicines are taking, that is action on the heart, it may produce some symptoms of the heart. Hahnemann, what was his findings of in a body? He developed medicines. We know that there are medicines, crude medicines are there. If we are using the Crataegus, it is in a crude form. That time it may affect. After that, If it is potentizing, potentizing means diluting and percussion, succussion, and everything is doing. That time, if we consume that medicine in the first potency, second potency, third potency, and up to 30 potency, it may develop some symptoms in the heart. That may be different. That may be a different. Yeah, in the mother tincture, it may produce some symptoms. In the 30th potency, it may produce so many symptoms. If it is used in the 200 potency, it may use several symptoms that it may produce. If it is using 1 or 2 medicines, also that time also it may happen. If in addition to that, if we are using 2 medicines, that time also the body will, the heart will change. Its action and functioning all will, different types of managements, there are different types of changes we can see. Their actions may produce different things. Different methods of actions we can see. In each and every potency, that may produce different types. That is why the dosage must be same. These are what we can say to the world, that each and every medicines of homeopathic medicines can produce symptoms, pathological symptoms. That is our scientificity. Somebody says that, oh, there is no matter. But we can say that matter can change, matter can potentize. That time it can change the whole body and whole symptoms may produce. That is what we can say to the world, that is the science of homeopathy. Whatever medicines we can use, it may produce. I want to say one thing. Our body having everything in the universe, every material in the universe is used for the composition of our human body. That is why a human person can sing like a violin, like a keyboard, like he can produce like a dum-dum-dum, like a drum. Drum can produce only drum sound, but human man can produce different sounds. He can produce different voices. He can do several things, different things he can do. Yeah, so each and every medicine, each and every material or element in our body that may produce symptoms. Whenever we are consuming, if it is natural more in a lower in a mother, if we are taking the common salt, it may produce a salty taste. But in the higher potencies, it may produce thousands of symptoms. So each and every part, element in the human, in the universe can produce some changes in our body. That is why whenever we are giving some medicine, homeopathic medicine, whatever medicine we can give, that time it may produce an action. Sometimes if it is similar, that time it may reduce the symptoms. If it is similar, it will completely cure the disease. That is what we can say. These types of product, homeopathic Hahnemann recorded all these things, and other doctors all return the things that what is happening. We are only looking the healing powers of homeopathic medicine. No, we have to study the pathological power of homeopathic medicine. What are the changes it is happening? So let us have an ECG. ECG is a simple test that can be used to check your heart's rhythm and electrical activity. Sensors attached to the skin are used to detect the electrical signals produced by your heart each time it beats. And we know that ECG is the one of the machinery which is used to find out the functioning of the heart. We know that there is a wave. If it is connected to some electrodes, then the heart function, we can see the electrode will show that this is the waves are going, the electromagnetic waves are producing in our body. So whenever this Whenever we use a homeopathic medicine, it may alter the functioning of the these changes. We can see that the wave can be changed. Electrical changes will happen. When we are using the lower potencies, that time the body, the muscles and of the heart may be more affected. But if we are using the higher potencies, that time electromagnetic waves of heart may change. If it is altered condition, we can bring it back to when we are using a similar medicines, we can bring it to the normal speed and normal functioning, and the normal rhythms we can see. Due to our day-to-day life and living methods and taking unwanted foods which are not better for our life, that time the heart may function badly. Normally, the cardiac output for a young and healthy man, resting cardiac output is roughly 5, that is in 5 minutes, 70 ml volume in a beat. 70 ml stroke volume, that due to 72 beats in a minute, for women this value is 10 to 20 lower. Where women's having lower cardiac output, men having more, 70 ml stroke volume. Each time it may beat, that time it may go till our last. Whenever that volume is reduced, then there is symptoms of heart complaints, or we can see heart complaints. The circulatory system, cardiovascular system pumps blood from the heart to the lungs to get oxygen. The heart then sends oxygenated blood into arteries to the rest of the body. The veins carry oxygen poor blood back to the heart to start the circulation process over. This is what is happening. Everybody knows it. Now, blood pressure, which measures the force of our blood pushing against the walls of your arteries. Heart rate or pulse, which measures how fast your heart is beating. Respiratory rate, which measures your breathing. Temperature, which measures how hot your body is. Here, these are the changes. Whenever a heart is affected with any disease, the speed of the heart may reduce. Flow of the heart may reduce. That time, we can use homeopathic medicine to bring it to our normal functioning. We know that blood is coming to right atrium, right ventricle, and it go to the lungs, and again it comes to our left atrium and to left ventricle, and it may go to the rest of the parts. We can see that some complaints, it is normally, we know that if a child having tonsillitis for many years, quinsy and pus formation of the tonsils, it may produce some ascose nodes and some materials, small nodules here and there, and it may reach to heart and the flow of here we can see that the tricuspid valve, mitral valve, there are valves are there. That valve may damage, and that time it may produce valvular diseases. Here also valvular diseases, we can see that valvular diseases, then the heart may functioning not normally. The speed of the heart may reduce, and there is stiffness of the valves, and it may produce leakage of blood to back, or it may come back from aorta to left ventricle, and from right atrium to ventricle to, sometimes it may go whenever it is pushing to blood to go to the pulmonary artery, then it may go back to the right atrium. That is a condition we can normally it may have developed in each and every person, but other body materials that may produce our hormones make it back, and it may clear it. And whenever we need, most of the time we will not understand that what is happening. So normally there is numbness of the fingers and blood flow. Whenever the blood flow reduces, that time cyanosis, coldness of the body, the parts of which lower parts. Just a minute. Lower parts may get cold, and whenever the heart, calf muscles are not working properly, and they are not taking exercises, they are not walking, and that time our calf muscles, it is also otherwise called as the venous heart. It will not pump it is against the gravitational force. It may pump the blood to the heart. If it is not functioning well, that time our lower parts of the body, there is congestion will take place, and more blood will congested in the lower parts of the body, and it may produce edema of the leg, edema and pain of the leg. And whenever there is reduced blood flow to our fingers, that is the extreme parts of the body, that time it may have coldness, pain, and it will not get the nutrition. From we know that all these functions are better how whenever the intestines, our intestines absorb our food and take it may come to the heart, and it may distribute it in the different parts of the body. When the distribution is impaired, that time our nerves will not act. The nerves will have starvation of our bodily parts, and it may start from the lower part to the peripheral to the central area. We can see that. I told you that this is the sinoatrial node. ECG. Whenever we can see that this, if you understand the picture of this sinoatrial node, bundle branches, SA node, AV node, this is the current supply to the heart, different parts of the heart. From here, it is like an autonomous body. From here, it produces the energy, and it may go to this part, and this come to this part. Whenever we can see in a ECG, here there is the strength is reduced, then the P wave will be shallow. After coming to this, here we can see that if it is not functioning, the pumping will reduce, the heart function will reduce, and that time we will not get the blood. So the PQRS, PQ wave to RS, then here from the right to the left, whenever coming to the left, whenever the heart left is more weakened, if the other point where if it is weak, then the heart function will reduce. So just whenever we see ECG, we can see that if it is perfect, then we can say that the heart is okay. When the other things, if it is shallow, that means that the heart is not functioning properly. The blood will not get the different parts of the body. So the problem is here. We can see that blood vessels. Anatomy of the blood vessels. Blood vessels consist of arteries, arterioles, capillaries, venules, and veins. Vessel networks deliver blood to all tissues in a directed and regulated manner. Arteries and veins are composed of 3 tissue layers. This is the layers. Here, if fat metabolism is impaired, that time fat may adhere these places, and the lumen of the blood vessel will reduce. We know that heart muscles also having blood vessels. The muscle supplies blood vessels. If it is blocked due to the fatty degeneration, we know that if it is fat and other materials, calcification, if we are a smoker, nicotine will attach to the body of the heart muscles. And that time we can use arsenic ignatia are the medicines for nicotine, tobacco. And for whenever there is calcification, we can use calcarea floor, calcarea carb. And we may think that, oh, heart muscles will not have any action of, it is not written much in the calcarea carb, but normally the calcium deposits we can use with calcarea carb, calcarea floor, crataceous, we can remove the calcarea calcium deposits. And other medicines, we know that, we doctors may know that phosphorus, arnica are some of the medicines which are using mainly to remove clots, blood clots, and fatty degeneration, pulsatilla. And we may think that for pulsatilla having no much symptoms about the cardiac symptoms, but pulsatilla may help a lot to remove the calcification of the fatty degeneration of the heart. Phosphorus, arnica, blood clots, it may. Some of the medicines that may, we can see that here, normal artery, narrowing of the artery, it may develop lipid deposits of plaques. Coronary artery diseases are, coronary artery means that is the supplying the heart muscles. The different stages are there. When we can see that these are the symptoms: unstable angina, pain, occasional pain. Unstable angina can be undiagnosed chest pain or a sudden worsening of existing angina. That is chest pain. Heart attack, heart failure, arrhythmia, that is the rhythm changes, abnormal heart rhythms. Valve disease, high blood pressure, congenital heart conditions, inherited heart conditions. These are some of the heart conditions. In most of the cases, we can use spigelia, cactus, carbobase, china, arnica, Viscum alp, digitalis. Most of the 99%, 95% of the cases can be cured with these medicines. So some of the congenital heart conditions also we can manage. Inherited heart conditions also we can manage. I have treated many cases, even congenital heart diseases also we can treat. What the things are, we have to remove all the things which is making heart weak. So that is the method of treating. We can see that blood vessels. So whenever we go through the heart conditions, heart diseases, we should, if the blood vessels having the lumen is smaller, then the blood coming to this area will be, the pressure will be high. Normally there are, in different parts of the body, the pressure may be different. But whenever the heart is functioning abnormally, that is the weaken. If the heart is weak, that time whole body will not get the proper blood circulation. The blood vessels, the method of treating the blood vessels is very must. While treating the heart diseases, we had to clear the blood vessels. Whenever we clear the blood vessels with these medicines, what medicines I told you earlier, then normally the big BP will reduce. Spigelia, cactus, carbamide, China. These are the 4 medicines I am normally using to reduce hypertension. It may make normal. Plaque formation, we can see that area of the blood vessels of the heart itself may be collected with these fatty materials that plaques. It may function, it will not function normally. These are the stages of heart diseases. In ischemic heart disease, there may be pain. First stage, second stage, third stage, we can see that only a few blood is flowing through that blood. That time, there is damage of the heart, myocardial infarction. In the first stage, if we can get, if the first or second stages, we can treat with these medicines and we can reduce the complaints. Coronary artery, atherosclerotic heart disease that affects the arteries to the heart. Valvular heart disease that affects how the valves function to regulate blood flow in and out of the heart. Cardiomyopathy, this is a painful condition that affects how the heart muscles squeezes. Heart rhythm disturbances, the normal rhythm will not be there. Normally, love, 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 we can hear. But in arrhythmia's condition, love, love, love. Sometimes the intervals may be in between these stages, there may be some change. Just a minute.
Excuse me, doctors. Doctor, we have only 5 minutes for the class.
Okay.
Later we'll start the discussion session after 5 minutes.
Okay. I know it.
Hi.
So these are the, let us go to some heart attacks and this is the first part. We can see that heart is damaged. Left ventricular hypertrophy. This is another condition. The heart may becoming more, the ventricles become bigger. That time there is chances for a collapse. Shortness of breath. These are the normal problems when we should not neglect it. Left ventricular hypertrophy usually develops gradually. You may experience no signs and symptoms, especially during the early stages of the condition. As left ventricular hypertrophy progresses, you may experience shortness of breath, fatigue, chest pain, often after exercising, cessation of rapid pounding heartbeats, palpitations, dizziness, or fainting. When I was a student, one person came to my clinic. No, my clinic, my sister's clinic. That time I was there. Immediately he came to my clinic, and within few seconds, within a few minutes, he died. One person I sent some symptoms. He told me that some gastric problems. I have some gastric problems. So I checked and found that he's going to heart attack. I sent him within 1 hour. When he reached the medical college, he died. So these are the symptoms. Whenever these are the symptoms coming to our clinic, we should give much importance. Don't neglect it. So this is up to this. I am stopping here, and anything. I am closing my screen share. Now you can. This is. It may be a continuous class. You may take for several times. There's time for us. Now, thank you all hearing for me and your patience. Welcome. And I want to discuss with the doctors. I am not a person to say anything, but I want to hear from you. That is why I am here. So I want to please share your knowledge to me, and anything more you can add. Thank you very much. Okay.
Thank you, sir. Thank you so much. We had a very extended class on pathophysiology of cardiac system, and he also mentioned specific medicines for some of the conditions. Now it's time for the discussion. So as Dr. Hubert has already told, we will have more conditions and more cases from more senior doctors. So we will have an active discussion. Dr. Eliama George has raised her hand. So, madam, you can talk now. We will unmute you. You can unmute by yourself, doctor.
Unmute, doctor.
Please unmute, doctor. You can unmute, doctor. Dr. Eliama George. Madam, can you hear me? Doctor, you can unmute your mic. Okay.
Yeah.
Now you can
Okay.
speak.
You can speak.
Sir, your class was very well satisfied. But one doubt I wanted to ask: left ventricular hypertrophy. What are the symptoms shows?
I told you that shortness of breath, pain, chest pain here coming each and every time. We will not notice. Sometimes we will not notice. We don't care. The negligence. I think I say that negligence of the doctors in such conditions. So palpitation of the heart, palpitation, occasion pain, any pain of the chest, we should give much importance.
Any pain,
any pain,
even pain, area of the
chest.
But whether any suffocation at that time?
Yeah. Suffocation may be there. In some conditions, if the blood is this is all developed from gradually. It is developing. If the heart muscles is it may affect the whole heart, whole body. You know that whenever the heart is function, the function is reduced. That time, all the function will be reduced in our body. So it may develop gradually. It may develop. So if it is in the breath, shortness of breath, that time we know that if the oxygenation is reduced, that time the heart muscles will not get. It may be starved. Starvation will be there of the heart muscles. That time, shortness of breath also may have.
What is the medicine for that?
That is we can use it. We know that arsenic alb, carbovase. Carbovase is a very, but it is not written much heart diseases. But carbovase is an important medicine for heart diseases. Then we have to ventilation. Proper ventilation is needed. Oxygenation is needed. So carb animalis, immediate medicines we are using are arnica, aconite, amyl nitrosum, digitalis, spigelia. These are the medicines. Whenever we are treating a cardiac patient, we have to make his blood more good. If the blood is good, it may clears the if there is any calcification, any this fatty degeneration, or blood itself wash out the thing. That is what I want to say. First thing is to drink water. More water, drinking water may reduce the density of the blood. If we have 6 liters of blood, if we drink 2 more liters, then the volume of the blood will be 8 liters. That 8 liters, it may diluted. The blood is diluted and it may pass throughout the body, and the blood vessels may be cleared. If we are walking for some time, after walking a few minutes, then after 10 minutes, our blood vessels will increase that size and the lumen will be increased. That time the blood, if we have consumed more diluted blood, that means we have taken more water and drinking, and after drinking we are going for a walk. That time it may go throughout the blood vessels and it may clear some of the. It may each and every time the exercise give good
Exercise
effects.
is advisable during that period when they are getting pain.
Pardon?
Exercise is advisable during the time when getting pain.
No. That time we have to give medicines, and we have to, there may be some edema of the chest. Whenever there is conditions of edema, that time the edema is more than what the condition, then we have to give rest. After the edema is reduced, then we can make small action, yoga and breathing exercise.
No,
we can
during the
do.
time, what time?
No. During the time we should give rest.
Wow, only drinking water.
Only small exercise.
No,
Walking.
during the edema, during the time, drinking water.
Yeah.
Not advisable. Huh?
Yeah. It is advisable. And we have to clear the drainage system. Urine, if it is going
during the time, is there any breathing exercise is advisable?
No. That time, whatever he can, if he gets some comfortable exercises only recommended.
Okay,
sometimes he may get some
thank you
relief if the conditions may be ameliorated by taking some small breath and by keeping some time, that we can do it.
Okay, thank you. Thank you very much.
Thank you.
Thank you, madam. Thank you so much. Now you can raise your hands. So we'll unmute and you can take part in the discussion with the doctor. We will have some more experiences on these cases. You can share your experiences.
Dr. Joseph is there. I want to hear something from Dr. Joseph, sir.
No, I did not hear anything, so I can't say anything.
Heart diseases.
Yes, Dr. Hubert.
Okay.
It's an important thing. Discussed almost all things, but need some sort of clarification always. What to do? How can we be conducted? And we need some sort of experience rather than talking. We have to develop. Almost all physicians must develop some sort of protocols. What to do? What should be the approach when a patient comes? What are the symptoms you can observe? In this way, if you are able to do that, that will be beneficial for the society, for the community.
Yeah, thank you.
Otherwise, everyone will be totally distorted. How to do, what to do, nobody knows. Because when the patient is in panic, the physician is in panic, everybody is in panic because we don't have much experience. In such situation, certain specific medicine should be used.
Yeah.
I think the amyl nitrate is the leading medicine in that case.
Yeah.
So,
I told it.
so when we consider about dozens of medicines, it's not possible to reach a conclusion. So it is always better to design certain protocols and certain mechanism in an institution. Then definitely we can. Moreover, our medicines are safer medicines. Then we can depend the symptoms, the concomitant symptoms there. That is most important. So in that way, we have to design a protocol. Then only you are successful. There is no doubt about that, but it needs more clarification.
Thank you,
Okay,
Doctor. Thank you. What I want to say is, we should have an morphological study of each and every person. That is what, from the appearance, we have to learn it. That is most important. Whenever a patient coming to our hospital, we should understand that he is a heart patient. Seeing that patient, we can understand that he is a heart patient. Seeing a person, we can say that he is a kidney patient. From the morphological studies itself, it may say that is what a doctor needs, very much needed. Several times from the external appearance, please. From the external appearance, we can understand. That is why Hahnemann developed constitutional medicines. Whenever we see a patient, we can understand that this is the constitution. Not first, we are always thinking the doctors making a mistake is that they are always thinking about the medicine. With the medicine, they are thinking. Don't think about the medicine whenever coming a patient to our clinic. First, we have to understand.
Hubert, please explain. Would you give some clues regarding what are the areas where a person should look?
If we can say that if a person is not taking water, then
no. I am not mentioning that. For the objective, the signs, what are the areas? For example, tongue, nails, eyes. There are certain areas, the shape of the nose. This is very important to decide.
Doctor, I am not talking to some layman. I am talking to doctors. So I know that doctors, what they know, I know that what they know. That is why I am leaving all this. No, I am not talking to illiterate persons. They are all doctors of having much experience with doctors. So I am not.
Could you please listen? One thing you must understand that we are handling a lot of cases. So it is not possible to remember all these things. That is why if you have much experience on that, please share on that. That is I just requested you. Okay.
Okay. Then somebody asks, then I can say. Nobody is asking. Yeah.
Now Dr. Danesh has raised his hands. Dr. Danesh, you can speak now.
Good evening, Dr. Hubert. Really an interesting session, though a different session. And we have a lot of things to do with this cardiology session, because a lot of nowadays the number of patients in this cardiology department is increasing day by day. And the main reason may be due to the lifestyle problem, of course, but that may be the reason. But nowadays things are entirely different. A lot of people are getting sudden collapse and sudden stroke-like symptoms, just like cardiology symptoms. And it is due to this vaccination, and maybe due to vaccination, and mostly due to vaccination. So we will have to differentiate whether it is a case of post-vaccinated complication or something like that. So for that, we will have to take this D-dimer test to every patient before you go to treat. But in those cases, we can give homeopathic medicine to stabilize the patient from this post-vaccination complications. And then thereafter, if there is a typical cardiologic symptom, just like as you know, the primary symptom in a cardiologic patient is palpitation on exertion, and then only the other symptoms, so there's chest pain, hand pain, and everything comes out. But if this is if there is when you expect something like that, then definitely you can think of this cardiology problem. And then we will have to do all those tests to confirm that it is a typical case of cardiology. And then don't get panic here. Then we can go directly with our remedy. Yesterday, in our Zoom itself, one of the homeopathic lovers stated that her father was suffering from cardiology problem, and she got excellent recovery after taking Cartagus tincture within 2 months of treatment. And that's the beauty of homeopathy. Choose the right remedy at right time. That will definitely end up with a good and speedy recovery to the patient. What's your opinion on that, Dr. Hubert?
Thank you, Doctor. I shared it. I shared it, that condition yesterday's doctors. Here now it is very dangerous position. Whenever hearing that collapsed after collapsed, they gone forever. No time is getting. Even treating the patient, we cannot. Yeah, and I haven't get any case, but that is what we are reading in the newspapers. So before that, whenever, and I ask many patients, if whenever a patient coming with any symptoms, that I may ask whether you have taken the vaccination. So I shall do some medicine for to rectify the bad effects of. I used Tuja, Silesia, Arnica. These are the 3 medicines I prefer more for such conditions. Pulsatilla also having good results. So these are the 4 medicines I think that it can manage. If there is some side effects of the vaccinations, if we suspect, we may ask that how many vaccines you had taken. If they say that I took 3, that means that he's in a very dangerous position. If he says that 2 vaccination, yeah, I have some experiences with some persons who are taking just after taking the vaccination, they had.
Excuse me, Doctor, it is already 9.
Okay,
we have to start our Malayalam session.
Okay. Thank you.
Okay. So I feel we all feel that we need more therapeutics based on this topic from Dr. Hubert, and more case presentations. So we will have another session if it is possible. If time allows, we will have another session on another day. So he will present more cases. So thank you all doctors. Now I take this valuable moment to thank Dr. Hubert for his effort to take a class on this vast topic. Thank you, Dr. Hubert, in the name of IFPH and all of us presented here. Thank you, Doctor. Now I thank each and everyone who is here to attend the class, who are rendered their valuable time. Thank you, dear doctors and dear well-wishers. Thank you each and everyone. Now it's time for the Malayalam session. I welcome Dr. Ashok Kumar for the Malayalam session.